join.
Hey, good afternoon, everybody. I hope that you can all hear me. My name is Susan Martinez, and I'm with Aetna. And I just wanted to let you know that Aetna is committed to building a healthier world, community by community. In Pennsylvania, Aetna's meaningful collaborations, measurable investments, and proactive responses to community needs empower Pennsylvanians to have more control over their health and overall well-being. With our longstanding presence in Pennsylvania, we have a commitment of service and support to our members and beyond in every corner of the state. When it comes to serving small businesses, we have been leading the market with Aetna Funding Advantage, or AFA. AFA makes self-funding an affordable option for small groups, providing the predictability of a stable monthly payment, the protection of stop-loss insurance, and cost savings when medical claims are low. Since 2016, Aetna has enrolled more than 60,000 employees in AFA in Pennsylvania. We will be hosting a webinar with the Chamber on Wednesday, July 1st at 10 a.m. I hope that many of you are able to attend. Thank you for your time today. I'm Susan Martinez with Aetna, and I look forward to working with you to build the best healthcare plan for you and your employees.
Workers have been incredible. Thank you. And thanks again to so many of you who are presenting today. We really did pull this together in COVID-19. Our commissioners, Congressman Dan Muser, State Representative Doyle Heffley, our hospital leaders, Terry Purcell from Lehigh Valley Hospital and John Nisfoli from St. Luke's. And of course, our leader of the Pocono Tourism, Chris Barrett. Thank you for bringing us the Pocono Promise to really get us back to work. And that's really just to name a few. So I want to thank all of you for your collaboration and support. So the chamber kicked in full force once COVID-19 surfaced. We didn't skip a beat, and we learned how to help our business community more than ever. Thanks to our amazing staff, Kathy Henderson, Allison Pickle, Alice Wanamaker, Linda Rex, Liz Bloss, Mike Moreno, and Kaya Jenkins. Also want to say a special shout out to Lauren Spence, who's with us from the Lehigh Valley today. And our business community, man, you guys are tough. You're incredibly resilient, and thank you so much for being Carbon County strong. It takes a great leader, an awesome coach to drive servant leadership during a pandemic at its best to ensure that we're helping every single business out there. Ladies and gentlemen, attending our first official in-person chamber event, the man, the myth, TV show host, radio show host, and really the driver of Gotta Get Back, please welcome President and CEO of the Greater Lehigh Valley Chamber of Commerce, Boss. Thank you for the support that you give to all of our communities, but especially the love that you give to the Northern Tier. Welcome, Tony Iannelli.
Usually we would hug, right, Marlon, in the old days? You know? And I was ready, but whatever. Welcome to the new universe. Wow. I think we got all the sound stuff. This is our first one, and I'm so thankful, Marlon, that, and I guess Carbon in general, you all are amazing. And there's a certain fortitude up here that really I love, and a certain sense of community that makes Carbon tick the way it does in the whole Northern Tier. So Marlon, thank you for doing our very first hybrid event. We got people on Zoom, we got people live, so that is our new universe, and I'm just thankful to be part of it. So many good people up here, and if you were here live, you'd see a lot of really nice people, and they have their masks on, except when you go up to speak. And frankly, a lot of people look better with a mask on. I'm just saying. I'm not going to get into names, but I'm just saying. So it is my pleasure now to introduce the Congressman. And what I want to say about Dan Muser is this: that first of all, he was the Secretary of Revenue under Governor Corbett, a very successful business person, and I think that's hugely important today. Dad was a police officer, is that right, Congressman? Yeah. So a great history there. But I think most importantly, Congressman, you never waver. People know exactly where you stand. You're willing to fight the fight. And right now, I think from a business perspective, we need people to drive us back. We got to get back. We've got to get people working. We've got to get our neighbors back to business because it's really, really important. I think it's safe to say that the physical patient, the health of the physical community is good and much better. Our hospital's not inundated like we were concerned they would. And now it's time to focus on the economic patient. So it is my pleasure to introduce my friend, Congressman Dan Muser. Come on up, Congressman.
Thank you all. Wow, it sure is nice not just talking right into a camera. I think I'll lose this, right? We've all got kind of used to all the Zoom meetings and all. I had a couple this morning. Hey, this is really nice. As soon as I heard that we were going to have a few live folks, I absolutely wanted to be here. Blue Mountain looked beautiful. You know, even just driving up and seeing that how green it is, and as it looks green, we're turning green midnight tonight, right? So, so yeah, absolutely. So that'll allow a lot more outdoor activities and the many things that can be done here. So we're moving forward. That's the name of the game, and we got to keep on thinking forward and leaning forward and maintaining a high level of health and safety. We're getting a thumbs up. I guess that's for you, Marlon, right? But hey, really want to congratulate the Carbon Chamber, Marlon, Tony, all the things that you do, but you, Alice, Kathy, you know, you all are just highly engaged, very active, highly inclusionary, just on the cutting edge of asking for help when you need it, and just being highly proactive. It's really a great organization. I look forward to. I hope we have our golf tournament in the summer. So count me in for that. But hey, I pleased to come in and speak for a little bit, offer a few updates from the federal side. I mean, you know, how much time do you have? I could pretty much go on. Tony mentioned a little bit my background. I think we know each other well enough at this point, and it's really been an honor to serve over the last 18 months to represent all of Carbon County and the 9th District as a whole. You know, it's been a very interesting 18 months, to say the least. We started with a shutdown of our government. We were told that we didn't have a border crisis. We did have a border crisis. We went through, frankly, in the federal side, bills that didn't go anywhere because they were very, very partisan in nature. Perhaps these things happen. You know, it was a very difficult atmosphere. And then we rolled into impeachment. And then as soon as that got done with, then we had the coronavirus. We had a good response, a very bipartisan response on the federal side, right? With the CARES Act, the national emergencies being issued. And the focus was right. The focus was on the crisis. It was on the people, first and foremost, and that was provided for via the stimulus funds, the economic impact funds that were sent out to families. We focused on hospitals, making sure the hospitals got reimbursed for their corona-related expenses and everything else that they needed to do and prepare, which fortunately, again, Carbon did such a great job in social distancing and confinement. All the things that we needed to do during that 4-week, 5-week period were done. So the curve was definitely flattened. But we focused on employees, right? We extended the employee compensation for those who couldn't go back to work. We set up the PPP, the Paycheck Protection Program, which worked out actually extremely well. There were definitely a few flaws in it that we dealt with, and I and Representative Heffley dealt with all day long, frankly, for a number of weeks. But we got through that. For the most part, businesses were able to hold on while they were being asked to shut down. I prefer to use the word slow down, but in many cases, of course, in Pennsylvania, they were asked to shut down, and some didn't, right? We got to remember that. But many did because of the bipartisan nature of focus on solutions and what needed to be done. Schools received money. Schools need to receive more money. We must open up our schools come September. That's critical to our livelihoods and our society and our economy. So I'm going to speak a little bit about that. We have this Main Street, fund that is set up, and I want to talk further with the county commissioners and all about some of the funding that's available there. I'm not sure we're all completely aware of the very low interest, very extended loans that are available. And we have to find a vaccine, right? We've got to find remedies. The president has initiated something he called Project Warp Speed. And, 60 days ago, you heard people like Dr. Fauci saying how we can't expect a vaccine until the middle of next year. Now, even this morning, Dr. Fauci saying, we could have one by the fall, maybe by the end of the year. So some good things happening there. We did deal with a pretty significant curveball that came out of the state government. It was difficult to get a handle on, primarily because none of us were involved in shaping it, in laying out a program that was best from a health standpoint, that was best to save lives, but also would sustain livelihoods. Unfortunately, I think those decisions made by the governor's office were made in a non-inclusionary manner. And that's, from my years of business, that's how mistakes happen. You need to be more inclusionary. You need to take in the views of industry and Blue Mountain Resort and legislators and others to get it right. And by laying out a life-sustaining as opposed to essential, picking and choosing who's going to stay open, it was just, and then you can file an appeal if you thought you were missed. It was just a bad process. Clearly, there were going to be significant flaws. The entire supply chain to the life-sustaining was shut down, not deliberately. How would you know? How would you know if a machine shop was making a component for a ventilator, which were in high need and high demand at the time? You simply would not. So many of them were shut down, and it was a problem. Then on the data end of things, right? And look, nobody likes a Monday morning quarterback, but you can't just talk about the data and then follow your own agenda. You have to actually follow the data. And so we missed a lot, and that wasn't just done in Pennsylvania. It was certainly done elsewhere. But on the same note, we learned a lot, and we can definitely come together more now from that, as opposed to just holding on to some ideas that perhaps have proven not to be in the interests of lives and livelihoods. So we can still move on. And that's going to be very important. We're all here wearing masks, right? I mean, if we're going to properly and deliberately open up and stay open and avoid any recurrence, we've got to continue. We've got to follow workplace health and safety standards and social health and safety standards. And we really shouldn't be pushing back on it. We should be embracing it and just making it part of the solution. And really, that's the most important thing, right? Well, just doing everything possibly part of the solution. It was a shame that divides were created and many things became political. I mean, this is really a time for us to come together, not be pulled apart. And we need to be viewing things in that way, acting in that way, and building trust. Right? That's what it really comes down to. I mean, the people need to be trusted. Those making the decisions need to be trusted. And the best way, again, of doing that is by communicating, is by providing input and not just listening, but also responding, being inclusionary, being smart. You know, why can't Pennsylvania be the smartest at this, at keeping a high level of health and safety standards within our workplace, within our social places, yet at the same time be opening up our economy? And we're moving in that direction. And I certainly hope we continue down this road, because as I mentioned, it's essential that our schools open up and the rest of our economy continues to open up as well. So we then, of course, had another serious curveball thrown at us, and that was the issue, the terrible issue with Mr. George Floyd and a rogue police officer, I think we could say. Because I think we all know that 99% of our police force are trained, are there to protect and serve. But you know what? Even on the Philadelphia police force or any police force, if there's 10,000 people, that leaves a few bad apples out there. But once again, we've got to be focused on the solution. We're in Congress right now working on a couple of things, working on the phase 4 for the CARES Act, but we're also working on a law enforcement reform bill. Was talking about it quite a bit today, all day yesterday, and we got to make sure we get this right. We can't overreact. We can't overrespond. For the most part, our police forces are do the job that we want them to do. But clearly, when there's somebody like that individual, that officer in Minneapolis that's on the force with 18 grievances, 18 different records of assault and police brutality that is still on the force, clearly we can improve. And we should be listening to the police force. We should be listening to all sides in getting this right, and we plan to. Moving forward on the CARES Act, we'll see what happens. Unfortunately, Speaker Pelosi came forward with an initial so-called phase 4, that was done in a very confined way. So when you do something in a vacuum in a partisan manner, it usually goes nowhere, like this one did. So now we're hopefully going to do things smarter, be more involved. My passion for it is definitely behind the schools, behind continuing allowing businesses to open in a safe manner, and transportation infrastructure. Transportation infrastructure is certainly an area that states lost a tremendous amount of funding, because for the most part it comes from gasoline revenues. With nobody driving, they're enormously depleted. So, and our economy, from a local level, statewide level, national level, could really, now's the right time for it. And my office and others, we put together some pretty good plans on how we could get rolling with a strong transportation infrastructure initiative. So I look forward to being part of the solution. You know, avoiding this politics, we talk about it, but it needs to be left there, and our actions need to be in line with moving forward, listening, cooperating, and you know, making Carbon County, making our state, making our country as great as it can be, and being part of what we hope is the next great American recovery. So on that note, I thank you all very much. I hope I wasn't too long.
Right on, spot on. Thank you.
Thank you so much, Congressman. The elbow bump, fist bump, we're all still getting used to it. And we appreciate, again, all that you do for the state of Pennsylvania and for everything you do for us here in Carbon County. It's really great to know your congressman, and we can't say enough how much we appreciate you being here. So next, ladies and gentlemen, I would like to bring up the state representative of the 122nd District here in Carbon County, State Representative Doyle Heffley.
Right, so I think watching all these state briefings, I think this is how it works. You have to take this, and Tony said I could speak as long as it takes to sing happy birthday twice. But I was running a little late this morning. I was leaving the house, and my daughter stopped me. She said, "Dad," I said, "What?" She says, "What are you wearing?" And I still had my pajama pants on, so I quick had to put some slacks on to come out. But new normal, old normal, whatever. It is. This is America. This is Carbon County, Pennsylvania, and we deal with what's thrown at us, and that's what we did here in Carbon County. I just want to really commend the Chamber for really stepping up, the Pocono Mountain Vacation Bureau, our healthcare networks, St. Luke's and Lehigh Valley, our county commissioners, and all the borough managers and township supervisors across Carbon County. Early on, when we seen this pandemic come in our way, we got together and we had a conversation. I said, let's make Carbon County the role model. Let's say the other places are going to look to us and say we did it right. We shut down a lot of things. The parks, the schools were closed, but you know, the community came together. We set up a different way to distribute the food at the food pantries to keep people safe. Our healthcare networks. I know that John and Terry can't wait till this is over because they just don't want to talk to me so much on the phone. But communicating with the Chamber, we were able to secure much needed PPE early on, thanks to sharp compliance. But also, I called a friend of mine up at Wentz's Auto Body. I called Chris Wentz up one day and I said, "Hey, you know, the hospitals need PPE. They need N95 masks." He said, "Well, I got 150 of them," and he donated them, and I had a couple boxes of gloves. But all the community, everybody stepped up together. Sharps with thousands of masks and gowns, and all that just went to our hospital, but it also went to our nursing homes, which needed it. And because of that, our numbers stayed low. People adhered to the policies that followed the CDC guidelines, wearing a mask, not shaking hands, and different things. And now, you know, we moved into the yellow, and now we're moving into the green, and we're going to get our economy back up and running. Carbon County, our economy is based a lot on tourism, and the Pocono Chamber and what they did to put together the Pocono Promise program, it is going to really compel a lot of folks to feel safe about coming back here. Our rafting outfitters worked through the CDC guidelines to get whitewater rafting trips going again. I was up in Jim Thorpe, and all the bikes were rented out for the weekend. So our economy is going to come back. Blue Mountain Ski Area opening up and doing the downhill biking and the different activities here. So we want to show people that it's safe to come here. At the same time, we ask everybody that comes here to follow these guidelines, and we're going to get through this and we're going to be the leaders as we were in keeping our numbers low. We're going to be the leaders in rebounding our economy, asking people to shop local. But as far as the state of Carbon County, I think with all things considered, we're doing pretty well. Really look at how the community came together, the elected officials, the business officials, the chamber, and everybody else to head on address this pandemic. And I think that's just tremendous leadership at all levels. Congressman Dan Muser, anything that our office called for to help at the federal government, Dan, your office staff is just amazing, always there for us, and that really counted. When Kathy Henderson, the small business loan program to help out the community, just really keep these businesses getting through this so we can get them reopened. And it takes a team. The county commissioners, anytime we called up there to the county commissioners, we had several conference calls discussing what we can do, the help that's needed, and it just all around, just really working together. And the state of Carbon County is really strong. I mean, right now we have groundbreaking for a new hospital at St. Luke's. Lehigh Valley is moving forward with their plan for their new hospital. Route 248 is out for bid. The bid has been secured by, I think it's J.D. Heckman Contracting, and they're going to hopefully be starting later this year to rebuild and finally finish Route 248, which I get more calls in my office about that than almost a pandemic. So Route 443, the widening project, which is going to be essential to that corridor and bringing business activity back. So we are still moving forward here in Carbon County. And it's my pleasure to serve the residents here, not just through this pandemic, but through every different thing that's thrown at us. We look at our communities, and there's so much harmony in our communities. We have people of all from New York, New Jersey, Philadelphia, all over the world, all over the country, every nationality, race, and creed, and things. People get along here, and I think it says something about the values and the culture of acceptance here in our community, and I'm very proud of that. And we're going to keep that moving forward, and we hope that other communities will look at us as a role model in that regard. So I thank you all for coming out today. It's great to be back at an event like this. I don't know how many times do we sing happy birthday? I got to go now. So thank you all. God bless. And just to keep all those folks that are suffering yet in our nursing homes, in our hospitals with this terrible disease, keep them in your thoughts and prayers. God bless.
Thank you so much, Representative Heffley. And speaking of our Carbon County commissioners, we're going to head over to Jim Thorpe, where our Carbon County commissioners are just finishing up their weekly meeting. We are joined by the chairman of the Board of Commissioners, Wayne Nostine, via Zoom.
Am I there? Hey, good morning, everyone. I don't see anyone. I don't see I'm on the screen if I'm supposed to be. What am I doing wrong? Can anyone hear me there?
You're good.
I'm good? Okay.
Yep.
All right. Sorry about that, people. Well, I want to thank Carbon County Chamber, the future business leaders of Carbon County, and all the sponsors we have that help put this program. I want to thank everyone that helped sponsor this program and put on today's State of the County. I'm really sorry I can't be there with you today and wish we could all do it in person. So I want to start off a little bit with some of the things that have been happening here in the Carbon County last year. In the election year, we have seen a large turnover in our row offices. We had 7 new elected officials. We had 2 new county commissioners. We had new controller, recorder of deeds, clerk of courts, pathonetary, and district attorney, and about the only 2 that did not change other than the courts were our treasurer and register of wills, who have 2 more years on the program, on their term. So this year's election has been challenging. It was postponed, delayed until just last week. Voter registration laws changed. Now you have up till 15 days before you have to register. From 30, you can register or apply online for mail-in ballot applications after the first Monday in February already, and the counties can start processing them more than 50 days before the elections. After you receive your ballot, you can return them by drop-off at the election office up until 8 p.m. on the election day. Mail-in ballots this year were very challenging for the county. Normally on an election year, we get about 600 mail-ins and absentees. Well, this year we had applications for 6,679, and we sent out 6,772. So 5,603 were returned. So this creates a lot of additional work in our elections offices. We had hired 2 part-time people that were supposed to be working just a few hours a week, gave them 500 hours each for the year. But we had them in there full time, and because of the volume, we even I had brought back one of our staffers in our office that were furloughed to help with the load, because it was very time consuming in getting all these ballots mailed out in a timely fashion, and we were getting 200-300 a day, so they had to be processed. So write-in votes during the election return, that became very time consuming. We had took about 2.5 days after the election to do all the counting of all those ballots, to count the write-in votes. They're still counting provisional ballots at this time. So yeah, it's been extremely busy and time consuming with the new process. And in the fall for the general election, we kind of expect that to kind of double in that period of time for the mail-in. So we're planning ahead. We'll have to add more hours to the part-time people and find additional space and staff to help with the election come fall. So we're working on that through a building project. So it's one of the other changes, no straight party voting anymore. The turnout was low at the polls this year because of mail-in voting. Deadline for county to receive ballots now comes in at, you have till 8 o'clock on election day to turn your ballot into the election office. So there were a lot of changes there. Going into the COVID and what it's done to Carbon County and how it affected all the major events and businesses that were closed and events canceled, businesses and nonprofits lost a lot of revenue. It's kept us extremely busy with conference calls, days, nights, weekends in the beginning in particular, daily updates among the commissioners and key people here in our office. Every day we'd have a conference call. We rotated 2 on, 2 off to kind of social distance ourselves between the 3 commissioners and our administrator. So every day we'd have a conference call to update each other on what was happening. So emails, almost impossible to keep up with, and many of those were duplicated. So on the county level, like I said, it was extremely challenging to meet our obligations and provide the essential services that could not wait. Public access was extremely limited. We curtailed most of the visits. It had to be by appointment only. Some of the things that we were doing, most of the offices had by appointments only, and we strongly encourage that at this point in time to, continue to try to make appointments, and if at all possible, we're asking that you do your county business online if it's available, and we're working on looking into how can we further that online process for county government. My fear is, should we get a second wave of the COVID-19 or any other disease that may come along in the future, we have to be better prepared. I think it all caught us with off guard, and it reminds us of how vulnerable we are to what can happen outside in the way we conduct businesses. So we'll continue to work on those things. Some of the other things we did, we put mailboxes at the entrances to all the buildings, and they were checked frequently, or you were asked if they were important papers that you notified that office by phone, and they would then check their mailboxes. The children and youth, adult probation, domestic relations, they all have jobs. They have a lot of caseworkers. And if we had reports of child abuse, we only have so many hours to get out there and process those or investigate those claims. So some of those offices, we could not furlough anyone as far as caseworkers, et cetera, because they still had a job to do. Adult probation still had to check up on their parolees and they're violators and house arrest people, so they still had things to do. So we've been extremely busy. Court cases are starting to pick back up now that things are changing. We will now have a big backup in court cases, and I am fear that at this point in time, it's going to require additional hours in some of these offices to catch up. The one good thing that has occurred for this is the prison population has dropped by over 60 inmates because some of those were sentences were suspended or will be completed at a later date for the work release, because our fear was if someone is out and comes back in for weekend sentencing or serve their terms, they would be carrying that disease back into the prison. So all visitation at the prison was stopped. No visitors, no one was allowed in except employees. New inmates were put in quarantine, and we took all the special precautions there. And most of those things are still in effect now, and we'll discuss that next week at our prison board meeting. Gun permits, the sheriff made an announcement today at our commissioners meeting. Because of the backlog, the gun permits, renewals, etc., were curtailed. They could not do gun permits. So the government extended the deadlines till July 31st. So we have approximately 600 renewals that they have to catch up on, plus approximately the 200 that they do a month to begin with, on top of that, plus the new gun permits that are being handled. So the sheriff's office is going to be opening up to keep the office open on a Wednesday evening till 7:30 by appointment only, as well as Saturday morning 8:30 till 12. To make an appointment takes 10 to 15 minutes. You must apply in person. You will be required to follow the safety guidelines, etc. Let's see, as far as county employees, at one time we had about 98 employees that were on full furlough, or we had reduced hours to 2 or 3 days a week. Most of those employees will be back as of next Monday, since the courts are picking up and moving forward. The county has been sponsoring a Zoom meeting with various stakeholders, the county chamber, Pocono Mountain Vacation Bureau, the Economic Development Corporation, the hospitals, emergency management, municipal managers, MSDS, and others on the process of moving from red to yellow to green and what we have to do, prepare in each stage, and just sharing information. And that has been quite successful, I would say. And we'll be doing it at least one more a week, every Tuesday morning at 9 o'clock, when we get about 30 to over 40 people sometimes on the call, just to share information and where we're at with opening up. Again, it was a little mentioned on the CARES, the funding. The county is working on how we're going to handle that. We strongly encourage all municipalities and those that may be eligible for reimbursement for funding out of that's $5.8 million under the CARES Act. Documentation. You have to have the documentation. It has to be COVID related. It's going to be a huge undertaking, a time-consuming and complex project for us. We're looking at hiring someone to help us because, all these going through all the receipts and everything else and documentation. So real quick, taxes, again, going over some basic things from last year. Very little growth in property tax revenues, have not been increasing with costs. Transportation here, of course, is a continuing problem. No easy solution without a huge financial investment. Veterans Court, they're progressing. They just got another grant for both drug court and specialty court. Homelessness, Women's Homeless Task Force has been created within a year. They've secured funding to purchase a building and should be taking possession of that building in the near future. Again, it's public, private partnerships, communication, collaboration, and a group of dedicated individuals that make these things happen. So projects, we're moving along on our training facility. The access road was completed. The site prep is now in place, or working on the site prep for the burn building, police training building, etc. We're finalizing the specs for those, hopefully go out to bids in the near future with a completion next year for the Emergency Services Training Facility. The DNL project, we will be going out to bids late this summer and hopefully start that project in the parking lot in November. Our building project, I mentioned elections. We're going to be renovating what was the old workforce investment building or storage building there, our garage on Susquehanna Street, adjacent to the 76 building, moving elections, workforce investment, and the planning and development office there where they'll have a lot more room. Kiosks, the pads are in for the kiosk machines. We have to work out the details on the handheld ticketing units and things of that nature, but that project is moving along, and hopefully by the end of July, we'll have the kiosks in place. So a lot of good things going on here in Carbon County, making great progress. We have a long way to go, and I want to thank everyone for participating today, and let's get back to business safely as soon as possible. Thank you, everyone.
Thank you so much, Commissioner, for that update. We appreciate working with you, Chris, and Rocky all year long. Your updates have been great, and we appreciate you bringing the community together. Next, we're going to hear from our speakers at the Greater Lehigh Valley Realtors Association. They not only represent the Greater Lehigh Valley Realtors, but the realtors in Carbon County and the surrounding regions. Joining us is Justin Parembo from Zoom.
Good morning, everyone. Thank you so much for giving us this opportunity to definitely present the data. And we're very excited to be a huge part of getting Carbon County open again, moving forward, and really restoring all of the great work that has gone on in the county and definitely moving us forward with the Carbon County economy. I want to thank the Chamber. It's always great to work with Marlon and her team, Lauren, Kathy, Alice, and Liz, as well as Tony Iannelli. We partner on a lot of, and work collaboratively here in the Valley and continue to do so within Carbon County. I want to take one moment and just thank Representative Muser and Representative Heffley because they totally get it. I will say that again, they get it. We were in the COVID fog here where our governor did not identify real estate to be essential, but both of these gentlemen did, and we thank you for that. We had a 2-month prohibition, but we are back open for business. And I'm going to walk through a little bit of the statistics of where we were within the end of 2019 into the first quarter, kind of where we are in the fog and coming out. With that, I also want to thank our hospitals. You know, a big part of real estate is that quality of life. I've spent a lot of time through the quarantine with my family on the trails up there and the DNL in Carbon County. Really pride myself and had a great experience growing up in Carbon and love working with all the entities up there. So furthermore, it's great that our healthcare networks and our recreation and everything that has expanded has really made everything top-notch in Carbon County and helps you know, with real estate as well as moving that economy forward. Let's go next slide. I just want to talk, as I call it, the COVID fog that we were in. Again, with real estate, we saw a 2-month prohibition. But really, you know, we were getting a lot of traction. We had addition of jobs for 9 straight years. The unemployment rate was at a 50-year low, historic low mortgage rates, which really worked out well for trying to get first-time home buyers excited and moving into this market. We were at the 10-year mark of the Great Recession, and everything that really got blamed and fell on the back of some of the horrible package mortgages and things like that. And wages were picking up, and I just stressed then, and we'll get to that in a little bit. Next slide, please. Just want to show mortgage rates. They're still historically very low, tied to the 10-year Treasury. We are seeing a little bit of an uptick of monies that now need to be put down coming out of the COVID fog. But with that, you know, we are very much in tune at the federal level to make sure that we don't have any breakdown of the government-backed entities of Fannie and Freddie, because we know that those 30-year mortgage packages are very quintessential to our housing market And again, it really still, interest rate wise, is a great time to get involved and excited within the market. Next slide, please. One of the things that you'll notice still today is that inventory and the lack of inventory is really shaping our greater Lehigh Valley Realtor footprint of Lehigh, Northampton, and especially Carbon County. And really, you know, with the inventory challenges that we're seeing even in the Valley, I think we are peeling back the onion where people are utilizing that 248 corridor. And it was great to hear Representative address that there will be paving and some things done in that corridor, because really that's really a key conduit of getting individuals from the mobility in the metropolitan area, and definitely peeling back that onion and looking more in the carbon market. Next slide. This points out of why it's essential to use a realtor. And really, you know, as we wrapped up 2019, we were getting about 91.4% of the original list price. So things were priced right, things were moving, and there were a lot of excited buyers that were coming into the metropolitan area. Next slide. That also bodes with a very strong median sales price. The median sales price to end 2019 was about $136,444. Again, this was, I believe, the highest on record that we've seen going back through our records in 20 years. And again, a lot of great expansion, as well as showing all of the fruits of your labors, that again, that Carbon County was open for business. And again, that real estate was really bouncing back and really getting top dollar for their entities. Next slide, please. So again, you know, the Carbon County experienced a stellar year in 2019, one of its best ever. And again, as I said, you know, that peeling back of the onion, where inventory was really driving from other continuous areas. But again, the inventory challenges within Carbon County were also identified. Closed sales were up about 11.9%. We saw a whole host of active listings coming to the MLS, but again, there was a lot of great traction, and really, unfortunately, never getting to the levels that we would like to see of that 6-month inventory. And again, inventory challenges were there. But that really boded well that at the end of the year, that actually grew, that the average price was then identified at 94.7%. And again, as I mentioned, you know, increasing that overall median sales price to an all high of $136,000. Next slide. This traction did carry into the first quarter, and we really have only Carbon County tracked into the first quarter of this year. But again, it came out very strong out of the gate. We had a lot of excitement, we had a lot of showings, and again, the economy was moving forward in terms of real estate. And then we kind of fell into the fog. As you know, really by the second week of March, the prohibition was put on. Were deemed non-essential at that point. And I think too that, you know, there were a lot of individuals that, as we're still kind of operating now, that we saw some inventory challenges where obviously with showings and things of that nature of people coming into people's personal property, we know that that will kind of resume once Carbon at midnight tonight hits green, and some things will definitely move forward to definitely keep the expansion of real estate and everything moving forward. I will say this though, we are seeing coming out of the fog that immediately we are seeing a lot of requests for showings. We see that that kind of the market has, as many economists talked, just been a V, where we feel real estate is moving forward with a lot of pent up demand from consumers. And we're hoping that this definitely continues to, even though we have a little bit of a delayed spring market, but to be very strong here over the summer and really get people in homes as the new school year opens up and comes to fruition. So again, you will see that new listings did decrease and put more inventory challenges on the table because of the COVID fog that we were in. And as I made mention, I think some people, not only with unemployment being an entity and a challenge, but also the fact that people wanted to stop mobility within their own home, and I think we will see an opening up of all of that. Next slide, please. Again, prices continue to get great traction out of the gate here in 2020. And again, you know, price increased in that first quarter to about 140. So we saw that upward mobility. And again, you know, inventory was really stifled again, and it was down 39.2%. And as I made mention, in a good economy, we want to see about 6-month inventory. When we talk about the month's supply of inventory, we're referring to the number of months it would take for the current inventory of homes on the market to sell, given the pace of people coming out to the market. 6 months supply is where we always want to be, and we feel comfortable. And really, 6 is really a good market to be in. As you see, we're at 3.1. So it's really challenging to keep, you know, all of those buyers, and really tends to be a seller's market in this aspect. And again, you know, that is also identified by the original list price as well as that increase in price. The COVID impact across the country, you know, there's a lot of, we're hoping that that V is very identified to be kind of moving forth out of this whole fog. But again, you know, we are very optimistic that we will get through this. We will partner with all of you to get us through this, and we're looking forward to move our Lehigh Valley and especially our carbon economy forward. Next slide, please. Again, next slide, please. Sorry, there was a duplicate there. Again, just showing again where the stifling came in. You could see exactly with this slide, right with the March economy, how again that inventory of homes dropped off drastically because of that prohibition and really stifling our real estate economy within the carbon corridor. Next slide. Really, you know, talking about that month's supply of inventory, you know, going back to 2017, where we see that 6.6, you could see how each year that inventory kind of got whittled down. But I use this slide to really show the impact of COVID-19 within that real estate market. And again, we're hoping to get that inventory up and get people and further buyers into the market and further sellers into the market to really fill in a lot of those inventory challenges. Next slide. New listings, again, this just shows really how right at the tail end of the first quarter, how again, really fell off the mark of new listings coming to the market. And again, it's something that we need to work, and we're going to be getting the word out, and that our corridor is open for business. And again, you know, these are coupled with all of the great projects, the hospitals and everything that is going on in Carbon County that we know we could excite and ignite this economy and get those listings out there and get further inventory out to our pent up buyers at this time. Next slide. The closed sales, again, very strong in the first quarter, right before the prohibition in March that took place. You know, January, February, historically, these are months, in these winter months. You know, we were blessed to have a very mild winter, even in the carbon corridor, that again, there was a lot of foot traffic out there. So again, this is just indicating that we were having such a strong winter market that again, we want to just get through this V, get everything restored and get everything moving forward. And again, it's going to be very interesting of where we are in the next quarter here. Again, in the Valley here, we're seeing, you know, we're seeing as a home's coming to the market, we're seeing 25 individuals wanting to come out and definitely take a look at those properties. Plus, we're seeing 50 offers on some homes in some aspects of the corridor with some of the brokers that I've talked to. Another thing that we're looking at right now is after the COVID fog, we are starting to hear of westward mobility of a lot of people from the Jersey corridor that feel that they want a little bit of space and they want to get out from really ground zero of where the COVID-19 really hit hard. So I was just talking to some brokers on Lake Harmony and some other areas on the northern part of the county just last Friday. So we're starting to see some of that western expansion happen at the present time. Next slide, please. Again, median sales price was very strong coming out in that first quarter, and again, soaring to an all-time high. And we want to keep that moving forward with all of the factors that I just kind of laid out, and again, harvest a lot of that mobility within the corridor. Next slide. I show this slide. I did show this last year. I show this down here, and this is my prognostication of 2020 coming out of the V and the COVID fog, that the Carbon County housing market will definitely be an intense game of musical chairs, just knowing where inventory is, knowing that that Carbon has a lot of things moving in a great direction, and again, with great inroads to our overall metropolitan area, and not to mention different corridors of other metropolitan areas. We're going to see mobility in there, and again, the demand is rising within the Carbon real estate market. So again, I'm seeing a very intense game of musical chairs, and again, we continue to want to work with the community to advance this economy. I thank you for your time. I'm going to turn it over to Matt Marks just to give you a brief update regarding the government aspect of real estate. And again, thank you so much for your time, and thank you for what you do. Matt, I'm going to turn it over to you.
Thank you, Justin, and good afternoon, everybody. It's a pleasure to be here again for the second time. Like Justin said, just a quick kind of overview of, coming out of the COVID fog, really the impact on housing, on the real estate industry from the government affairs side. So there was a House bill. It was House Bill 2412. It was actually introduced by Todd Polinchuk, who is a realtor. And this would obviously deem real estate members essential, being able to go back to work, not business as usual, but in a safe way, following CDC guidelines. That went through the House and to the Senate. It was passed in both chambers, but unfortunately was vetoed by Governor Wolf. A few days after that, Governor Wolf did come out with his own executive order, allowing real estate members to go out and to start working with their clients again. We had a very large lobbying and advocating program here, reaching out to our elected officials, asking them, please vote for this, please talk to the governor, please allow this to go through. We heard heartbreaking stories from clients and consumers who were in the middle of a real estate transaction, and when this came about, they were unable to complete it. They were left homeless, they were left living in hotels, they were left living in RVs. A lot of families, due to the large size, were split up. There was just heartbreaking stories that we were sharing with our members. After a long process, we were finally able to work with the House and the Senate, and then with the governor's office, to get our members back to work, and in turn, getting their clients the housing that they needed. Working now, we are seeing a huge pickup, like Justin said. There's a lot going on. And with that, the most important thing that I'm focused on right now is coordinating with our local governments, our local cities, our local municipalities on the inspection and certificate of occupancy side. Our initial fear was when our real estate members were deemed essential, there was going to be a rush of houses going onto the market. And in turn, the process where you need an inspection, you need a clear CO to close, that all of our municipalities and our cities were going to be kind of behind the eight ball, because unfortunately a lot of their members were furloughed during all of this. So with great communication, with great coordination in Carbon, Lehigh, and Northampton County, we were able to speak with the inspectors. We were able to have them understand the process of getting houses back to the market and getting those homes inspected quickly. So that's the process that we're really in right now, making sure that all of the homes are getting to the market, getting through, and then getting to that closing table in a timely fashion, in a timely manner. So that's, like Justin says, the 30,000 foot view of what we're seeing here. Obviously, we would like to thank Representative Doyle Heffley. He was a yes vote on that House Bill 2412. He was a huge advocate for Carbon County, for our realtor members. So we thank him, and we thank all of those who did vote yes. Moving forward, we are looking to a very busy spring into summer market. So I wanted to thank everybody again for inviting us for the second time. Moving forward, if you have any questions as far as real estate, as far as the housing market, please feel free to reach out to myself or Justin. We'd love to have a conversation with you. Hope everyone is staying safe and healthy, and I hope you have a great day. Thank you.
Thank you so much for that valuable information. We know partnering with our local officials is very important, and your partnership with Doyle on that bill really proves it. Our next presenter has been working with us side by side for the past several years. The Pocono Mountain Visitors Bureau is truly a great partner here in the Poconos to us in Carbon County and our surrounding counties. Ladies and gentlemen, please welcome Chris Barrett.
Hello, my glasses are fogged from this mask, speaking of COVID-19 fog. Thank you for everyone for having me here. It's so great to be with all of you today at this kind of event. And this is kind of indicative, I guess, of what the new normal is right now. So there's so many folks here with masks on in a yellow phase at a max. I could say these things in my sleep, but a max count of 25. So, but it is great to be in yellow because that means soon we'll be getting to green, especially in Carbon County. And it's wonderful also to see people getting back to doing some of the normal things that they've done throughout their lives. And Blue Mountain Resort right here is a beautiful example. The view is beautiful. There's great outside dining. It's socially distanced. It's very, very well done. And this is a sign that we're starting to get back to a new normal, though I don't think any of us really know or understand yet how we're going to be affected by a new normal. So in the Pocono Mountains consists of 4 counties as a tourism region: Carbon, Monroe, Wayne, and Pike counties. That's a 2,400 square mile area. It's bigger than the state of Delaware, so it's fairly large. Carbon County is the linchpin in a number of different ways. So we wanted to make just a couple of comments because we were asked a lot about how we see this rolling out. I mean, there were a number of industries that were affected very adversely by the closures. Everybody's been affected in some way or another. Hospitality, tourism was probably one of the industries that were hit the hardest. In fact, I don't think we truly know or understand how hard it's going to be hit until this process rolls out for another 3 to 6 months, and then of course a full year. But we do have some inkling. We do have some statistics we'd like to talk about. Some will relate to the full Pocono Mountains. Some will relate to Carbon County itself to kind of narrow it down. So the first slide is up, and I just want to talk about that. That slide really relates to the Pocono Mountains as a whole. So what does tourism really mean to us? So it's a $4.2 billion industry in the Poconos, and it really has been growing at a very strong clip in double digits over the last 3 to 4 years. That's really been for a number of reasons. The County have really been a big part of that, but also the width of everything that we have in the Poconos that makes it special has been, getting guests to come back and revisit us. Just a couple of other things. Tourism accounts for 37% of the region's economy and 65% of its labor income. That's a staggering statistic. So there are 11 regions in Pennsylvania in the tourism designation. This is designated by the Department of Community and Economic Development. All the numbers I'm going to talk to you about now are sourced from the state, from a company called Tourism Economics that studies these. And so that's a very staggering number. We have the highest degree of tourism numbers out of any region in the state in our 4-county region. So what does that really mean for Carbon County? So what it means is that about 4,360 people are employed in tourism in Carbon County. In total, tourism generates $445 million of spending. And again, this is all state data. And can we go to the next slide, please? This is all state data, so it's very verifiable and it's harnessed from everything that the state has. There's a couple of other statistics because what I want to do here is roll out where we think we're going to be. So this is going to roll out over a series of 3 to 4 slides to give you a basis of how we came up with this. Travel generates 36.5 million in state and local tax effect. So we'll talk about that in a minute. The federal tax effect is 36.3 million. So if tourism went away tomorrow, all that revenue would go away along with the 445 million that I referenced in the last slide. Just a couple of other statistics to give you some context. Jim Thorpe, Carbon County is one of my favorite places. I grew up in Luzerne. Jim Thorpe is a crown jewel of tourism. You could place it anywhere within the United States or the world, and it would be a crown jewel. So I'm kind of using that as a basis to kind of give you a little bit more information. We run a visitor center at Jim Thorpe. We have 400,000 people a year visiting that center. And most visitor centers where people come in and ask for information, the attendance has been going down because of the predominance of the web, of course. Ours has gone up in the last 3 to 4 years, predominantly because there's so many more people visiting the town. It's really growing dramatically, but the county is also growing. We have number 9 mines. Some of the smaller attractions are kind of adding to the growth in the towns. So I'll talk about that a little bit later. Again, we have 28 million people that visit the Poconos, all 4 counties. So of the 28 million that visit, 2.5 million people, keep this in mind, visit Carbon County specifically. So that's about 9 to 10% of the total. Next slide, please. So what I want to do over the next 2 slides is kind of talk about where we think the revenue will land within the next 6 months and really for the whole of 2020. So we put this into a calculation, and I'll make this very quick and then kind of wrap to the final slide. So if the guests spend 445 million and there are 2.5 million guests, or 2.25 million guests, each guest spends $197 when they visit the county. They leave $197 behind. Next slide, please. Also, too, we might want to ask, how does that look from a tax perspective when an outside guest visits us? What do they leave behind in this county? So we took the state and local number at 36.5 and divided it by the guests to come to a number of 1622. Okay, that's how we came with that number. Next slide, please. So I'm going to put this all together and show you what that looks like. So we're estimating, and we have a number of sources for this, that tourism will be down about 30% this year as related to COVID-19 for a number of reasons that I'll talk about as I end. What does that really mean to us? So the last 2 slides, we showed the spending, we showed the tax effect. The 197 in revenue loss, the 1622 in tax loss, is a total per person of $213. So if a person does not visit us, we lose $213 from that person not visiting. So that means if we lose 756,000 guests, that's 30%. That's 30% less than 2.2 million that visit us every year. We have a potential to lose 161 million in revenue from those guests. That means $161 million will not be coming in this county if 30% of the guests that normally visit each year do not. Also, too, next slide, please. Also, too, we know that from some of the studies that we have had done, that in a normal year, each resident in the Poconos would be paying $1,500 more per person in state and local taxes without tourism. So having looked at some of those numbers, which really aren't the best to share, where do we think we're going to end up this year? And that's kind of really what I want to talk about very quickly. We are a very strong regional destination, which means we're very close to population centers in New York and Philadelphia. That means that we will most likely recover faster because people will not be flying domestically or internationally or cruising or doing some of the things that they have done on vacations. They will most likely stay closer to home. We've seen, all the research that we've seen has noted that guests will most likely travel locally first within 200 miles of their homes, which does bode well for us. And as we continue to put COVID-19 in the rearview mirror day after day after day, I mean, thankfully, Carbon and Wayne counties will be going green. We expect Monroe to be going green somewhere around June 19th with Pike County. If that happens, we get further and further with COVID in the rearview mirror. People get more used to masking and social distancing and doing all the things that they need to do to mitigate. You know, you come to a great facility here like Slopeside Bar and Grill, and you see the servers are all appropriately masked. They're practicing the Pocono Promise and everything that they do. So that really helps any type of guest visiting to have more comfort that everything is being done the best way that it can be done. Again, we expect the overall attrition to be 30%. We base that on a number of things we've seen across the country based upon occupancy in hotel rooms across the United States and especially in the Eastern Seaboard. In March and April, occupancy rates were in single digits, which probably hasn't been seen since the Great Depression for a specific period of time. So that immediately took a lot of revenue out of the economy in the hundreds of billions. We think the recovery will take at least 6 to 8 months minimum. It could be 1 year, but again, we feel that our destination will come back much more quickly than most destinations. And as I wrap, one thing that I wanted to say is that our source of revenue for funding most of what we do comes through the hotel tax generated in all 4 counties. We're expecting that tax to be down by as much as 70% year over year. However, we're doing the best we can with the revenues that we have available and left over the next 2 quarters to market as aggressively as we can. So we'll be talking about that as the next 3 to 6 months go past. But again, we're always hopeful. We think people will begin to travel. There's a lot of pent-up demand for people to begin to recreate again. We're very confident that our product is amazing for all the people that provide that product here within the Pocono Mountains. We mitigated very quickly, as the Congressman and Doyle Heffley noted. I think that's a positive. Our health systems are amazing. They're great partners to work with. So again, we're optimistic as we turn to this year, to 2020 and 2021. And it's always great to be here to share some thoughts with you about what tourism looks like. We're humbled to be servants, to serve the 4 counties in the Pocono Mountains. And I'll leave you guys to the next speaker. Thank you so much for the opportunity.
Thank you so much, Chris. And speaking of the great partners we have at the health systems, we want to look towards them for a little bit of outlook as far as what's happening in the future here in Carbon County. Our next speaker is working hard as a great partner here in Carbon County from Lehigh Valley Health Network. Please welcome Terry Purcell.
Hello, everyone. It's great to be here. First of all, I'd just like to thank Representative Musser, Representative Heffley, the county commissioners, and Marlon and your team. You did a great job leading us during this COVID pandemic, and Carbon County did a great job, but I don't think we would have done as good if it wasn't for your leadership, so thank you for that. Also, I want to thank the healthcare workers. We're fortunate to have so many dedicated healthcare workers that put their lives on the line. I'm sorry. I'm going to get water, okay. Our dedicated healthcare workers, they put their lives on the line, their families' lives. So I just want to say thank you to all of them. Next slide, please. The Lehigh Valley Health Network, we're a huge health network. We have 10 hospitals. We're building one in Nazareth right now, and we're planning for one in Carbon County. We have the area's only children's hospital with over 30 pediatric subspecialists. We're a $3 billion organization. And last year we had our most financially successful year. We had a net income of over $100 million last year. So that helped us really address this COVID pandemic when we lost a lot of money. Next slide, please. Here's a list of all of our awards that we've got over the last few years. I think the most significant is from U.S. News and World Report. We were ranked as the 6th best network in Pennsylvania. So we're very proud of that and all the other awards we received. Next slide, please. The other thing we're very proud of, Times News did a Reader's Choice Awards last year, and Cedar Crest was voted as the best hospital by our residents, and we're also voted as the best employer. There's over 700 employees from Carbon County that work at the Lehigh Valley Network. We're just very proud that they're happy to work for us. Next slide, please. So here's a picture, a drawing of our new hospital. We're in the design phase right now. We're going through all the permits. The 2 big ones we're working on right now are PennDOT and DEP. With the pandemic, it did slow down some of our permitting. So we're hoping that we still hit our opening date of October of 2021. But right now, we're just not 100% sure. The hospital is being built out near Walmart. A lot of positive response from the public. If you go to the next slide, please. It's going to have 18 inpatient beds. We could expand it to 36. We think that's the right size for this market. Also, when you look at the future of healthcare, according to the advisory board, inpatient admissions are going to be flat over the next 10 years, but outpatient business is going to grow. When I got into the business a long time ago, you used to get 60% of our revenue from inpatient business and 40% from outpatient. And now it's reversed. So we only get 40% from inpatient and 60% from outpatient. So the future, you're still going to see outpatient services grow, and you want to see inpatient services grow. The emergency room will have 12 bays with 4 observation rooms. We're going to have full surgery, inpatient and outpatient surgery. We're going to have a 24/7 emergency department. We're going to have a medical office building that The first floor will contain all of our outpatient services, and the second floor will be physician offices. So we'll be bringing over 30 new physicians to the market, which the county definitely needs. As I said with the permitting, one of the most things I'm asked about is the artifact study that we had to do. That's what the community is most interested in. So that was in Indian land, and they were worried that it was a burial ground. So we had to do an archaeological study to make sure that there was no burial sites there. There were a lot of funny online comments about that study. I think one of the funniest I read was that someone said, and they were joking, that St. Luke's employees are throwing arrows on the land just to slow us down. Next slide, please. Last week, we opened up an imaging and breast health center and a health network lab in Lehighton at the old Payless store. It was very well received by the public. Before we even announced it was opening, we had 50 women call to schedule their mammogram, and we did them over the last week. So it's been very well received by the public. There's also a health network lab draw site there. Health Network Lab has one location in Lehighton. It's one of the busiest draw sites that we have in the entire network. The public will be pleased to hear that. We'll also have radiology, ultrasound, and general x-ray in that facility. Next slide, please. Local services. So in the last year, we did open 2 express cares, one in Lehighton, one in Palmerton. During the pandemic, we did decide to close down the one in Lehighton just for safety reasons. So we'll be reopened. We just don't have an exact date when that will be open. We have merged with Coordinated Health. It's very good for Carbon County. Coordinated Health has 9 physicians in the Carbon County market, 5 orthopods, surgeon, endocrinologist, and a rheumatologist. So we're very fortunate. That'll help us with our hospital as we open in a year and a half. We're affiliated with MatLab, and that includes Dr. Hanley, Dr. Lysak, Deb Smith, and Vanessa Rice. They're part of a group called MatLab, and they're affiliated with the Lehigh Valley Health Network. During the pandemic, we performed over 150,000 virtual visits. The public really took to virtual visits, and they were very well received. Yesterday, I read that CMS is encouraging face-to-face physician appointments. So I would hope that we continue to cover virtual visits because it's safe for some people have to go and see a doctor, but there's a lot that can be done virtually. So I would encourage us to keep covering video visits because I think they're very important for the patient. Primary care providers, we have 2 primary care providers right now. We're looking to add more primary care providers. Specialty services, we have vascular, neurology, cardiology, OBGYN, pediatrics, and pulmonology. We also like to partner with independent physicians. We have a thing called the PHO. It's a physician hospital organization. There's a lot of docs that want to maintain their independence. Some doctors don't make good employees, believe it or not. So we look for ways that we could partner with them. So we have a physician hospital organization. They join that. There's some financial benefit for that, but there's also some other benefits, such as when things were getting bad with PPE, we were able to give the doctors in our PHO some much needed PPE. So it's a good way to keep them independent, but then it's also a way to align them with our network. Next slide, please. COVID-19, I think we did an outstanding job in responding to the COVID crisis. We turned our Palmerton Express Care into a COVID site only. We encouraged people to come to call before they came in. We did a virtual screening at no cost. If they met the criteria, they came in and they were tested. Our network did 1/6 of all the tests in the state of Pennsylvania. So I think we did an outstanding job responding. We did over 1,100 tests for Carbon County residents. We tested, it's a little more than 124, I think it's 128 now. So half of the cases in the county, we did test for COVID and found them to be positive. But we did a great job with the screening, I believe that. Next slide, please. And one thing we want to encourage the community, that it's safe to come to the hospital. We saw such a decline in people coming in with heart attacks. They were dying at home because they didn't want to get COVID in the hospital. So we just want to reiterate, it's safe to come to the hospital. We're changing the way we do business. If you're coming for a doctor's office, we have you wait in your car until we're ready for you, just to reduce the amount of time you spend in the waiting room. We're trying to get you right into the bed. We're cleaning in between every visit. We have signs to show if it's if we clean this area or if it's not, just so the patients know that it's safe or unsafe to come into that area. So we're spreading out patients. We're doing more visits into the evening hours, just so people aren't having to come in contact with each other in the waiting room. But I think the state of healthcare in Carbon County is going to be very strong. We have two big networks that are competing, and that competition will result in better care for the patients, more access to care for the patients, and I think the county is going to be in great shape in the future. Thank you very much.
Thank you so much, Terry, for that update. We appreciate it. And thank you for all that you do in our community. Our next speaker from St. Luke's University Health Network has a commitment to the community, and he wants to tell us about it. Ladies and gentlemen, John Espoli.
Thanks, Alice. Good afternoon, everybody. Kai, let's go to the first slide. Next slide. There we go. So I guess I'll use this as an opportunity just to recognize the leadership in this county. And it's pretty incredible. I'll start with our congressman. You know, Dan, I know you have 10 counties, but I'm amazed at how well you know our local issues. And we're just appreciative of your support. And Doyle, I think I speak with you more than I talk with my wife. And she seems okay with that, by the way. And of course, the county commissioners, they're just great. Just very engaged in healthcare, more so than, to be honest, I've ever seen at the county level. The chamber's awesome. Marlon, Alice, Kathy, I think you know everybody in the county by first name. You're great with relationships, and you know Tony's the best. Tony is a good friend, and I think he runs one of the best chambers in the country. It's just a fantastic chamber. And also thank you to the chamber members. You've been a big part of this whole virus experience and getting through it. So with that, let's go to the next slide. You know, this is probably a good slide to recognize our employees. We've had great success in Carbon County in minimizing the impact of this virus. There's less prevalence of this virus in this county than any other county that St. Luke serves, and the mortality rates are the lowest, and that happened because of the community support, but it also happened because of our fantastic employees. We have 800 people working in this county, and last March was a scary time. You know, the early days of this, there was just tremendous uncertainty, and all 800 employees stepped up. Nobody checked out. Everybody got engaged, and it took a lot of courage and talent. We always talk about, you know, friends, taking care of friends and neighbors and family, and that's really what it's all about in this county. So our staff was incredible, and because of that, you know, we managed to keep just about every service, every site open through all of this. You know, we have primary care sites throughout the county. They remained open. The Care Nows, all the outpatient centers, you know, we set up 4 sites for testing for the virus that are still going strong, including the antibody testing. Obviously, the hospital kept going strong. Our behavioral health hospital, the physical rehab hospitals, all services kept going in spite of this enormous challenge. And not one job was lost in the network, which I think is incredible. Next slide, please. I think this slide is just a good example of innovation. If there's anything good that came out of this virus, it was we were forced to innovate, and just a lot of good trends that probably will benefit healthcare long term were accelerated. We certainly took advantage of social media to communicate with the community, and that'll continue to be expanded. We put together a great PPE task force that just searched the country and the globe for supplies, and we're in great shape now because of that effort. Telemedicine has expanded dramatically. We probably have accelerated the use of telemedicine by a decade, and that's not going away. And that's improving access to care, not just acute care, but outpatient care and all aspects of care. We worked with Lehigh University and developed some interesting technology, ultraviolet light sterilization for our N95 mask. There was a shortage, so this gave us the ability to sterilize and continue to expand the supply capability. Massimo is really a fascinating technology. It's remote monitoring of the patient in their home. The patient wears a device, and our staff can monitor all aspects of care, blood flow and oxygen content, and just all aspects of the physiology. And it's connected to artificial software so that as numbers change, we can in advance start to detect if a patient is starting to become somewhat unstable and intervene earlier. That's all home-based. It's incredible. And again, because of COVID, we launched this more rapidly than we intended to do. And the patients and the providers love it. And then we have a simulation lab that with 3D printers, and got that going to produce a lot of face masks and other medical supplies. Fascinating. Next slide, please. So now we're in a recovery. And again, Carbon County leads the way for the whole region. St. Luke's care is bouncing back much faster than I thought it would, to be honest. And that's great for patients. So patients are getting the care that they need. And in fact, we're almost at full volume levels that we were experiencing pre-COVID. And that's a tribute, I think, to our staff, to the trusting relationship that exists between staff and community. And that's pretty much across the board. And it's not, it is different. When you walk into our, there is a new normal when you walk into a St. Luke's facility. You're seeing social distancing. You're seeing universal masks being worn. You're seeing a change in the scheduling so that people cross paths less in the waiting rooms. And it's amazing to me how our staff have adjusted, and more importantly, how the community and the patients have adjusted to this new world and are getting the care that is needed. Next slide, please. The support from the community has been incredible. We've gotten countless donations of food. We all gained 10 pounds, 20 pounds during this pandemic, but there's food everywhere at the hospital, from all the restaurants, from people living in the community. A lot of donations of supplies and protective equipment. And there was something I thought was very touching. A couple weeks ago, the EMS community, the police, the fire surrounded our hospital in Lehighton with about 50 vehicles, and all our nurses and staff came out, and our doctors, and it was a tribute to each other. I don't get choked up about much anymore, but this brought a tear in my eye. The people giving thumbs up and fist pumps, and just shows the love and the relationships that make this such a powerful county. Okay, next slide, please, Kyra. So this is a nice list of all the services that St. Luke's is currently providing in the county. And I do think there's something very special happening here. I think we're seeing a rural network evolving that is going to achieve national recognition for excellence. We now have over 40 family practice providers in the greater Carbon County area. You can't go a block without seeing a St. Luke's provider. At least it's getting to that point. We have 23 outpatient sites, and we have full-time specialists that are based only here in this county. This is their home. This is where they have their primary base. And we already have that, and these are groups of physicians in cardiology, in general surgery, orthopedics, nephrology, which is kidney disease. And our goal is to establish that over the next year or two in every specialty, medical and surgical, throughout the county. We have 3 CareNow sites in the county, in Jim Thorpe and Palmerton and Lehighton, all very busy and all very accessible, 7 days a week, 4 physical therapy sites throughout the county. Of course, we have a behavioral health hospital. And not surprisingly, behavioral health got busier during this very, very stressful time, both in the inpatient center and the outpatient centers in the county. So we were so happy that we had the resources available to people going through hard times, and that'll continue. The acute rehab hospital, that's for physical rehabilitation, usually post-hospitalization. That is at full census. So obviously, the acute care hospital is very busy. The emergency department is back to full volumes pre-COVID. Again, that surprised me. I thought it would take longer for that to occur, but that has bounced back very quickly. Summit, the long-term care facility, that's very busy. We are going to move forward to renovate that and improve that facility. That long-term care is going to be a long-term commitment, as is transitional care. Transitional care is subacute. It's less rehab. It's typically for the frail elderly, those who just need a week or so to have moderate rehab to get stronger. And it's all about helping that person stay independent as long as possible. And then, of course, we have home care services that surround all of this throughout the county. Community health services, there are many. Many of you are familiar with our occupational medicine services. We have relationships with hundreds of employers throughout the county, and some great return to work programs for you as your employees come back to full employment. And
are working on a number of new services. In the fall, we have a new diabetes center coming to Carbon County with an endocrinologist and nurse educators. We're expanding orthopedics. We're up to 4 orthopedic surgeons now, again, 100% based in this county. ECT, that is a form of behavioral health treatment for those who are suffering pretty severe symptoms of depression and anxiety. So that's a new service we're launching at the Lehigh campus. A new pulmonary service is coming to us, both outpatient and inpatient this fall. We applied for a trauma center designation, and we hope to get that designation next summer of 2021, in advance of the new hospital opening in Franklin Township. So trauma can stay local. We are opening a new chemotherapy and infusion center this fall at the Lehigh campus. So local chemotherapy will be local under a highly trained St. Luke's medical oncologist and hematologist. And of course, the regional hospital in Franklin Township. If you drive by the site, the fences around the site, the construction trailers are up, and heavy equipment is now on the site, moving dirt. So site preparation has begun. This is awesome. And our goal is to have the foundation done this summer, steel going up in the fall, and building this region a beautiful regional referral medical center, again, to serve this county for the next generation and beyond. And a word about the quality of the services at St. Luke's. Again, there's just a very special progress going on. Our patient experience scores are soaring, and among the best in the network. Our clinical quality scores. There have been 0 hospital-acquired conditions in over a year in the hospital, which is amazing. The employee engagement scores. We were best practice when we got feedback from our employees about how they feel about their employment, how they feel about their fellow workers. So there's just something very special happening that is incredibly exciting for the county. Next slide. So that is the rendering of our beautiful regional medical center. It'll have 80 beds, 17 emergency rooms at a very high level. In-house, this is significant. In-house critical care specialists, intensivists, 24 hours a day, 7 days a week. So it'll be rare that a patient will need to be transferred. It'll be rare for a patient to have a need to leave the county for care. Trauma center, advanced surgical capabilities, advanced heart care, chest pain center, high technology in the interventional radiology and vascular care. And so it's going to be the hub of a regional network that, again, I think will achieve national recognition for excellence. So, again, I want to thank the members of the chamber, all the public officials, the great leadership in this county, working together. The future of this county is very bright. Thank you.
Thank you, John, so much. And, I really want to piggyback on what John said about our members. And really out of the gate, I want to recognize the Lehigh Valley Chamber's COVID-19 grant that we were able to give to so many of our businesses that in that first and second week, they didn't know what to do. They were told to close. So we were giving $1,000 grants, $1,500 grants just to keep the lights on, pay the utilities. And again, I want to thank our chamber members that really came forward to help BB&T, Jandal Farms, Equinox, and our local Walmarts. Again, we're just thrilled to be able to be part of this. I thank all of you so much for coming together to make this happen. But I really want to thank this young lady that I'm going to bring up here, Alice Wanamaker. This was all Alice putting this new kind of event together. So please give her a hand. She has done an amazing job.
Thanks, Marilyn. I love technology, so it was fun with Dave by my side. I knew we couldn't get it wrong. I know some of you online missed our shout outs to our sponsors in the very beginning. We had a little technical issues that we did figure out. So I did want to repeat them just to give a huge shout out for everyone that made this happen. Mach-Chun Trust, Pat Riley and his team, they are just amazing with everything we do, and they show their support every time. Sharps Compliance, they really did come through for our community. They brought PPE out when we needed it most in the very beginning, and we can't thank them enough for their partnerships. Blue Mountain Resort, Emily's standing over there, Barb Green and the team. Everything we do up here is amazing. Thank you guys so much for hosting us always and never saying no. Lehigh Valley Health Network, we can't thank you guys enough, for everything that you do, not only sponsoring our events, being on our board, being here today, and just supporting the community the way that you do. St. Luke's University Health Network, John and your team, thank you so much again for being part of everything that we do, being on our board of directors, supporting us here in the community, and helping us move forward. Our partners with Aetna, we know we heard from Susan earlier. We're so grateful for everything they're doing with us, and we look forward to partnering and hosting that event with them in July. Andrews Plumbing, Heating, and Air Conditioning, Danielle and her team are amazing. Dave Figenchew, the man making it all happen back there behind the camera. The Greater Lehigh Valley Realtors Association, our silver sponsors, Jim Thorpe Neighborhood Bank, and Future Homes. Again, thank you all for everything that you do to support the Chamber. On behalf of everyone here at the CCEDC, we hope you and your loved ones stay safe, stay healthy, and thank you for joining us. Those that are with us today will have lunch out on the patio if they choose. If not, they can take their lunch to go. Our audience who did support the event with a financial contribution will receive a thank you gift in the mail to come back and enjoy lunch or dinner here at Slopeside Pub and Grill. Thanks again, everyone, and have a great afternoon.